We are back. Welcome back to our next Tuesday topic. Been a couple weeks, but today we're going to talk about treatment prior to the big blow up. So treatment before you have that big old disc herniation or that shoulder strain happens. If we can intervene a little bit before that happens, we can avoid the blow ups, avoid some of that stuff. So if this is our graph here, dysfunctions on the y-axis. You know, we're early on, the pain hasn't really kicked in yet, but maybe we got some range of motion loss, we got some stiffness, we got a tight shoulder, our elbow tightness, a stiff mid-back, something like that. There's some silent things that are going on. Maybe your overall pain hasn't kicked in yet, but we got some of those silent killers that are going on. If we can intervene at this point, you know, get rid of that mid-back stiffness, get your shoulder to work a little bit better, get some of that tightness out of your elbow, stuff like that. If we can knock all that off the table before some of the big blow-ups, that'll make all of our lives a lot easier. Versus if we kind of let those perpetuate a little bit, shoulder gets a little bit worse, mid-back's locked up, maybe low back's working too hard, something like that. And then we get that big blow up, and it could be something simple. You know, I bent over and tied my shoe. I throw one extra baseball, something like that. Then we get that big blow up, and we get this big injury, a disc herniation. You know, something more orthopedic, something causing some damage. Now we have that big inflammatory reaction. Our body's kind of fighting all that. Then it makes life a little bit harder. We can still treat it at this point, and we'll take care of that, but it just makes things a little bit tougher versus if we get on top of it early, kind of treat the whole system and avoid some of those big blow-ups. We'll call them silent derangements here. So if we can get ahead of some of those big dysfunctions early on, we can save ourselves a lot of headache. No pun intended there. So that's my plea to you to get some of those stuff taken care of before they become a big issue, before we need to intervene a little bit more. So get some of those little things looked at, especially you athletes that are a little dinged up early in the season. Take care of that stuff early on. So any questions, comments, we love to hear your feedback. We'll catch you guys next Tuesday.